I'm Dr. Levitt with Levitt Medical Aesthetics, and today we're talking about the Halo laser. So the two lasers on the Halo is an ablative and a non-ablative laser. So the ablative laser actually vaporizes a portion of the skin. It's a fractional ablative laser. Both the lasers actually are fractional. So it leaves the majority of your skin intact, which makes a lot less downtime. So one of the nice things about Halo is there's a little bit of downtime associated, but not much. But the ablative laser is relatively superficial. It does a really good job with pores, texture, fine lines, and wrinkles. The non-ablative laser is able to get much deeper into the dermis, and it's really good with deeper pigment, deeper UV damage. Some of it is not pigmented. But when we get rid of it, it makes your skin look a lot brighter. Also does a great job building collagen and elastin and, again, helping with fine lines and wrinkles. So we can do the Halo anywhere on your body, really. The most common place by far would be the face, but we also commonly do it on the neck where it can help with crepey skin or pigmentation issues. We can also do it on the hands, again, a lot of times for aged crepey skin and pigmentation. So before we do Halo, we're always gonna numb you for about 45 minutes to an hour with a topical numbing agent, which makes the Halo way more comfortable. However, you can't really numb heat, and the non-ablative laser does have quite a bit of heat. So through the procedure, it tends to get, the sensation is mostly just heat, and the longer we go over the area, it just gets a little hotter. We do have Zimmer Chiller, which really helps a lot with that. So Halo is one of the most customizable treatments that we have. So we can customize both lasers individually for both their depth and the percentage. So for example, if someone has a lot of pigment, then we're gonna keep things a little bit more superficial just to get all the pigment out of the epidermis, and it'll do a really good job. Versus an older woman that maybe has a lot of wrinkles around the mouth. If we wanna get wrinkles, we're gonna go a lot deeper with the ablative laser. So we really can set those parameters individually to address your concerns. We can also address it by area. So maybe in your forehead and cheeks, it's more pigment, or around your mouth, it might be more fine lines and wrinkles. So we can set it separately for those areas to most ideally treat both those areas. The downtime is typically, it's less than a week. So depending on how aggressive we go, which kind of depends on what you want to do and what your skin looks like to start, at the most, it's going to be about 5 days, but typically you're going to get some redness, some swelling, and then you're going to get something called mens, which is all the pigment coming out of your skin. All that happens about day 3 or 4. So really by day 5, you've got a lot of healing, and by day 7, it just looks good. So it really doesn't matter how aggressive we go, it's just how bad the downtime is for that period. At 3 to 4 months, you're gonna get even better results because a lot of the improvements with building collagen take some time, but we'll have you back at 2 weeks to do a follow-up, and everyone is usually blown away by the results from just their first treatment. If you wanna learn more about Halo, you can give us a call, come in for a consultation, or you can find us on our website at levittmedicalaesthetics.com.